What is a biopsy for bone TB diagnosis? Have you ever wondered how doctors diagnose bone tuberculosis? A biopsy for bone tuberculosis diagnosis is a medical procedure where a small sample of infected bone or surrounding tissue is taken. This sample is examined to check for the presence of Mycobacterium tuberculosis, the bacteria responsible for tuberculosis. The analysis includes microscopic examination, culture, and molecular tests to confirm the infection and guide treatment. Bone tuberculosis, also known as skeletal tuberculosis, affects bones and joints. It can be tricky to diagnose because its symptoms often resemble those of other conditions. This is why a biopsy is a vital tool that provides direct evidence of infection. The procedure itself can be done in a couple of ways. One common method is fine needle aspiration, where a thin needle is used to collect tissue. This is often guided by imaging techniques like computed tomography or ultrasound to ensure accuracy. If the needle biopsy does not provide clear results, an open surgical biopsy may be required. Once the sample is collected, it undergoes analysis. Doctors look for specific features of tuberculosis, such as granulomas with caseous necrosis. These are clusters of immune cells that react to the infection. Sometimes, acid-fast bacilli, which are the tuberculosis bacteria, can be seen under a microscope with special staining. Another important step is microbiological culture. This process allows the growth of Mycobacterium tuberculosis from the sample, confirming the diagnosis. It also helps in testing how the bacteria respond to various drugs. The positivity rates for cultures from bone biopsies are quite high, often over 80%, making this method reliable. Molecular tests, like polymerase chain reaction, can also be performed. These tests detect bacterial DNA in the biopsy samples quickly and accurately, even if the bacteria are present in small amounts. One of the advantages of fine needle aspiration biopsy is that it is less invasive than an open biopsy. It has proven effective in diagnosing bone tuberculosis and offers a faster and safer alternative for confirming the disease. The results from the biopsy are interpreted alongside clinical symptoms, imaging studies like X-rays or magnetic resonance imaging, and other laboratory tests. This comprehensive approach ensures an accurate diagnosis. In conclusion, a biopsy for bone tuberculosis diagnosis is a crucial step in identifying the tuberculosis bacteria or characteristic tissue changes in the bone. It confirms the infection, helps differentiate tuberculosis from other diseases with similar symptoms, and assists in tailoring the right antitubercular treatment. The procedure is generally safe and minimally invasive when using needle techniques, supported by microbiological and molecular analyses to ensure diagnostic accuracy. If you suspect you have bone tuberculosis or have related symptoms, it is essential to consult a healthcare professional for personalized advice and treatment options.